Hello, I'm Mona Locke. I'm a former reporter and Chief Communications Officer now at Swedish Health Systems. Swedish is the largest nonprofit healthcare system in Washington State. And we were on the forefront when COVID hit here, along with other healthcare systems, really trying to battle this virus. And so instead of our normal weekly Facebook Live program, we decided that we would bring you actually a live tour of our ICU here at Issaquah campus. So Issaquah campus really felt the surge of COVID patients at the very beginning. And joining me, I'm going to bring in our Dr. Chris Dale, who is also our Chief Quality Officer. And Dr. Dale also works here as an ICU doctor. So welcome.
Thanks, Mona. It's good to be here. It's great to be at Issaquah, too. Issaquah has been a campus that's really been at the forefront of treating people with COVID, and I'm really excited to give people a tour behind the scenes.
That's right.
But you know what? Before we go in there, we got to wear masks.
That's right. Our policy here is mandatory or required mask when we go into areas with COVID, correct?
Yep.
So lead me through this.
Sure.
Proper way.
Both our patients and ourselves. So first we got a gel in our hands. So here we are, right in front of the geller. So we got okay, clean hands.
Okay.
And we have these masks, which have only been our faces, so they're clean. And then a pro tip here, obviously, is pinching the nose, pinching the bridge so it fits nicely, and then it goes over your nose and over your ears.
And it is
you can adjust.
Okay. So over the nose, over the ears, and then you adjust this, and then you pull this down.
Down, there you go. And
so it's fully covered.
Excellent. And since we just touched our face again, a little more gel. Gel never hurt anyone.
Perfect.
All right.
Thanks so much for that. So Dr. Dale is going to lead us through the intensive care unit, and we'll talk to some of the actual caregivers real time about their jobs, what it's been like to work through this COVID crisis. So I'm going to take the camera now, and we will continue with Dr. Dale.
We got a badge in. It's a secure area. All right.
So here we are entering the ICU.
We're going to start here.
And who do we have here?
So here we have Renee Hawkins, who's the manager of the ICU here.
Hi, Renee. Thanks for letting us come in today.
Sure.
And so we just want to talk to you. You want to come with us and help lead this tour? This is
absolutely
your place. What has it been like since COVID hit? Let me just start with that.
I guess the word that comes to me is surreal, and feeling of solidarity. Those are the two things that I think would probably describe the biggest impact. It all started back February 28th when we got our first patient. And then just a few short hours later, we got our second patient and had 3 by the end of the weekend. By that Monday, we moved off all of our telemetry patients off of our unit and converted everything into a full ICU here.
Wow. And that was even before we knew much information about COVID?
Yes. Yeah, absolutely.
So the greatest challenge was?
Converting the unit. Yeah, that was probably one of the biggest challenges. Making sure that we had enough ICU staff as well. Very supportive CNO here who had the foresight to seek out and get us some help right away, which I think was really beneficial for us here at Issaquah. And actually, you know what, I want to introduce you to one of my charge nurses. Okay. She was really instrumental in helping prepare our unit for the first few days, the first week. There was a lot of work that was being done in trying to go from two ante rooms, which is what we use for isolation, to having a whole unit being prepared for the COVID patients and what we're going to be expecting to see.
Let's take a walk down here. We're trying to make sure that we respect the patient privacy.
Yes, absolutely. Thank you. So this is my charge nurse, Tasha.
Hello.
Hi, Tasha. Nice to meet you.
Nice to meet you.
Okay, tell me a little bit about yourself and what you do here.
Well, I'm an ICU charge nurse. I've been here about 5 years. So basically a ICU nurse. I make sure the staff have everything they need to do their job. You have to be a leader on the unit, especially during all of this COVID-19.
What was that like when it all hit?
It was very scary. We were all very nervous about what we were going to be dealing with, especially when we got our first patient, because no one really knew what was going on with this virus, how it was spreading, what it did to people. So everyone was very scared, of course, but we all pulled together to work as a team. Going into this, we were a very strong team, so I think that's why we were successful in going along with all the different changes that came about after we got our first patient.
And what has that been like? I mean, trying to keep safe, trying to keep your patients safe?
It's been it's been a lot of hard work, that's for sure. Keeping up with everything. As a charge nurse, I think one of my major jobs was making sure that everyone was up to speed on all the different changes, keeping up with the CDC and the WHO and all the different recommendations we were getting, making sure everyone felt safe, that they felt had the most up-to-date knowledge on everything. So just constantly rounding with everyone, constantly making sure that they were comfortable with what they were doing, because we all have our own families to think about and our own safety too. So it's really important that the caregivers felt safe also.
And
So Tasha, I was curious about something. So this isn't how things normally look. So can you take us through kind of like what we're seeing here when we look around? Because there's like blue tape on the floor and there's an orange box by your shoulder there.
Yeah, so our unit was converted to negative pressure in preparation of receiving more COVID patients. And one of the things that we did was we have the makeshift ante room, just a good visual on. It's more of a visual for the caregiver going in and out of the room. So when they're coming out of the room with their mask, their N95 still on, this was a good place to be able to doff those last pieces of PPE, and people seem to really like it.
For those who don't know, what is doffing?
Taking off, yeah. So taking off your personal protective equipment. And we have all of our carts outside of the room too, so we don't contaminate anything. We have these COVID-19 specific isolation carts that have specific PPE in them. And we've really worked to really streamline what we've put in here to minimize waste. So you don't see boxes and boxes of N95s because we don't want to waste anything. And then we have all of our gowns down here. We've also been really fortunate with the community donating PPE and making PPE. This was made by Ford, so it's a face shield, which helps protect caregivers' eyes, and they're also their mask too when they're in the room taking care of a COVID patient. And then
We heard the beeping.
Yeah, so that is so our all of our rooms are now negative pressure in the ICU, which is very great for caregivers and patients.
What does that mean?
Well, that means that any aerosolized particles, any aerosolized virus will not escape into the hallways. It will be filtered out, and it's filtered out, and so when it goes out into the outside, we're not, pumping COVID-19 out there. It's all filtered out through this big device. Yeah, we can go inside and see. It's a little loud. Yeah, a little loud in here. But this is a typical ICU patient room for when we have a COVID patient. So we're able to monitor them. All your typical ICU stuff. And then the caution tape is just as a good reminder for staff to not put any equipment back here because this device needs space in order to do its work.
And what's that big tube?
So that's what filters out. That's where the air is going out after it goes through the filter.
So you're actually pumping the air from this room outside.
Right. Yes.
So that.
Right. To keep spread of prevent spread of the virus into the outside hallways. So yeah, we're very fortunate to have this because not all facilities are able to convert their rooms to negative pressure. So
that's wonderful. And Dr. Dale, you've been in here working here. What's been the biggest challenge as a doctor in the ICU?
Kind of the logistic hassle of taking on and putting off the PPE. Tasha, what do you think is like most different about taking care of a COVID patient versus a patient without COVID?
Well, there's certainly a pause before you enter the room, as far as you have to think about protecting yourself. So you have to put on all of your PPE before going into the room. And, you know, you have to kind of remind everybody of that we can't just run into the room. We have to keep caregivers safe. And I know I keep going back to this blue tape, but I actually think the tape helps that because we're not used to having to pause.
So that tape is actually a reminder.
It is a reminder. It is a reminder that you need to stop and don your PPE. And we're constantly looking at best practice and best ways of efficiently doing that, but also being safe. So we have upped our staffing to help support that. So we have safety monitors, so a staff member who actually will watch the doctor or the nurse put on and take off their personal protective equipment so that everyone is safe. That's the biggest thing, and that the patient gets taken care of in a timely manner.
Oh, okay. Renee, what has been your biggest challenge in terms of making sure that this unit is up to date? And
Are we
thank you
Tasha?
so much, Tasha. I'm sorry, I didn't mean to
Tasha.
leave. But in making sure that this unit is up to date and updated on all the stuff going on.
You know, there were so many changes that occurred truly daily, sometimes hourly, that was going on. We implemented, after our routine safety huddles, we did COVID huddles. So as a management leadership team, we, with infection prevention and all other departments, we met right after that to discuss COVID and all the changes and clarification, and then just really utilizing the charge nurses as well, who are here 24/7 to help get that message, so that we were staying current with all of our shift huddles, you know, rounding with all of my team as much as possible so that we're all speaking the same language. You know, things changed pretty quickly, and our whole world went from, you know, a mixed ICU tele unit to all ICU, where we saw today's a little bit different. We've actually decreased a little bit of our census, but we were up to 5 times our normal ICU patient population here. So really relying on the whole entire team, our intensivist, a huge part of our team, our respiratory therapist, can't do it without them. And just making sure that everybody is speaking the same language, inviting everybody to our team huddles, sending out communication. Email got really overwhelming really fast, where people just couldn't keep up on it. So we're really fortunate too with our infection preventionists here that they would come up and round with the team as well.
That's great.
And just constantly answering questions, making sure that, you know, things made sense. You know, when something didn't sound right or feel right, we raise that question, you know, and get that clarification.
Thank you. I know it was very hectic, but it seems like
Yes.
it's starting to, at least we say here in Seattle, feeling the lull and the flattening of the curve.
A little bit, yes.
And I'm sorry to interrupt you, but do you have a second to talk? I understand we have Dr. Leckie.
Hello.
And can you introduce yourself to the group?
Sure. My name's Ann Leckie. I'm the ICU medical director at the Issaquah campus.
Okay, so what has it been like? We've been talking about the preparation
Yeah,
and transition, and from the doctor's perspective.
Right. So Issaquah is our high-level containment unit for the Swedish hospital system. So we were already sort of ready for this after the Ebola preparations a couple of years ago. But so we were prepared to be the primary campus for the coronavirus outbreak. Of course, it got big enough that that it needed to go to all the campuses. But we've been having 24-hour ICU coverage and have really been doing great. Actually, our outcomes are fabulous for the patients that have been in our ICU. So we're really proud about the entire team.
And this is where you take care of the sickest, right? I mean, pretty
That's right.
much.
Yeah, so the ICU takes care of patients that have respiratory failure and blood pressure issues, so people who are on breathing machines and people who are needing high-level support of oxygen and of blood pressure management.
So what was your
Kidney
biggest,
injury.
what was your biggest concern through this COVID period?
Well, the safety of the staff was a primary priority for us. So we spent a lot of time making sure that all the staff felt like they were making sure that they were all trained appropriately to take care of themselves, because we needed them to to be able to stay safe so they could continue to care for our community. And then we were all obviously worried about the scope of the outbreak, but Seattle's done a fabulous job in terms of social isolation and limiting the spread of disease. We were also concerned about just communicating among the region, so we started a text chain from this campus, but out to all the ICUs in the system, not just the Swedish campus, but also to Overlake and Evergreen and Virginia Mason, University of Washington, et cetera, so that we were all communicating in real time about what was happening in all the ICUs.
Well, that must have been very helpful as a collaborative approach.
Yes, and we're really fortunate in this region. Critical care doctors are by nature sort of team players, but we all have the luxury of knowing each other and getting along really well. So we quickly transformed each hospital into sort of a large team.
Oh, that's great. Yeah. That's wonderful. Thank you so much for talking to us. All right, let's continue the tour. Oh, here is, and can you give me your name? Bissy?
Missy Davis, yeah.
And tell me what you do here.
I'm an ICU nurse here on the floor.
Okay. And I wanted to I would ask to talk to a nurse about communications. I know that in this critically ill area, the communications were difficult sometimes between COVID patients and their family.
Yes, we've definitely had to overcome some barriers just because in order to keep the community safe, we're asking that family members don't come in to visit. So we as nurses have had to learn how to communicate with family members as well as patients, and we've done it a couple different ways, which has been really interesting and kind of cool for us as nurses to be able to partake in it, along with our taking care of their body. We're also taking care of their emotional and mental side as well.
How do you do that when they're isolated?
So a couple ways that we've done it. One way we do it is I've used a patient's cell phone and tried to FaceTime with their family. We've also coordinate with a family member. We call them before we're going to go into the room and let them know, hey, we're going to be in there in 15 minutes. Can I call you from the room? And then if the patient isn't able to do that for themselves, we put the phone up to their ear and let their family member talk to them and still feel like they're connected in that way. And then us as nurses, we always try to keep the family members updated, not just once a day, but hopefully multiple times a day, and build that rapport with them and just update patient family members and just let them know what's going on since they can't be here and touch their own family members. So it's been really interesting moving into that realm. We've also had patients, family members, and friends bring in like stacks of notes and grandkids' art and things like that. And one time I got a whole gallon-sized Ziploc full of just really fun family memorabilia and updates on the family member. And that day I was able to wake her up out of her sedation. She'd been there for 2 weeks, and when she was awake enough, she still felt a little weak, so I was able to hold up the cards and read them to her. And we spent probably 30, 40 minutes just going through everything, every piece of art, reading every word. And it was really sweet to have that moment with her and be able to bring her out of that and be like, yes, you have been here for 2 weeks, you have been tested positive, but all these people are here for you, we're here for you. So that was really special to be part of that moment for her too, to realize, oh, I'm part of that number now. And it was cool to be able to tell her she was doing better and she was on the mend, and have those family members encourage her too. And then I was able to put them up on her wall so she can see them from her bed too, just as that encouragement, since she still had to be isolated because she was still here in the hospital. But just to be able to let her see that her family members were here too and that we're here for her.
Oh, that's wonderful. Is it rewarding or what? I mean, it has to be rewarding.
Oh, absolutely. It's rewarding, but it's also just who we are and what we do. Like, it just felt like that was just what to do in the moment, and it just felt completely natural, and it didn't feel like I was doing anything special or out of the ordinary. It just felt like that's what she needed, and that's what I could provide for her. So it was really special, and it's rewarding too, because it's a small community. Word goes around, and those family members were able to say, "Hey, there's a nurse, Missy on the floor," and it was cool to make that circle come around. That other people knew that I was there for that particular patient too. So it was very, very touching and very, very rewarding.
That's wonderful, because in this tough time, I think it's always nice to know that you're appreciated. And I know that the public and everyone really does appreciate everything. Yeah, thank you so much, Missy, for sharing with us today.
Talk about the public and community support has been just absolutely overwhelming. We've had people who have gone and put signs up on the overpasses that we love Swedish. The support and outreach has been, I mean, truly overwhelming. We've had donations of, snacks and food, and there's this wonderful woman who was interviewed on, I think it was on one of the local TV stations, who has started a fund for both the local restaurants and healthcare workers, and has actually been donating lunch and dinner for at least 3 weeks now. And just the outpouring of support. I came into work one day and there was blue ribbons tied around each tree. Aww.
That's so touching.
It's cool. Yeah, it is touching, because I've been a nurse for 26 years, and it's the little things that get you. This is what I've done for a long time, and I've never really thought anything of it, that I've done anything real significant, for lack of a better word. And then just to see how you touch other people's lives. I mean, what we do is a gift. We see people at their most vulnerable times, and just to have that support back has been pretty amazing.
No, that is amazing. And I think that the community support has been amazing for everything they have done for our caregivers and bringing those meals.
Yes.
And does that really help the meals and everything?
The first time that came, you should have seen people's faces. I mean, it was really, like I said, it was surreal what we were experiencing here, and there was just something about how the heaviness, everything was just lifted. I mean, people actually, it was, I mean, do you remember the first meal that came? This is Bethany, one of my nurses, and it was just,
Our first COVID positive patient I remember very well, and how well he did. It was one of the wins where you go home at the end of the day and it's like, your team won, it was the Super Bowl, and everybody's having a party. It was just the most rewarding feeling, that you could experience in caring for these COVID patients that have no one visiting, and you're the lifeline between them and their family, and you're trying to keep your spirits up because it's hard work, and then keep their spirits up. And I remember when we extubated him, we took his tube out, and he said, "What happened?" And I said, you're positive for the coronavirus. And I just think he was in utter shock, just trying to process that, because he probably didn't remember before they had put the breathing tube in for him. So that was a great, a great moment that we kind of celebrate. And that room in particular, that's the lucky room, that's the great room. Good stuff always happens in that room now.
That's a wonderful story. I'm noticing too, I just want to point out that the folks in here who are doing the cleaning and making sure that everything keeps folks safe.
yeah.
Right? Everyone's working hard. It takes
Yes.
a team, a
It
village.
takes a village. Absolutely. Yeah, and our village has even expanded. Our OR team, PACU nurses, endo nurses, all of them, their censuses have all decreased, and so they've come up here to help us. The OR team is amazing about how they observe PPE and making sure people stay sterile and protected all the time, so they've been great protectors. They've also come up and literally, I was surprised the other day, somebody just came up and they just started cleaning, helping out EVS. They just had a bucket and they just went for it and just kept cleaning. And
that wasn't their normal job.
No, that's not their normal job. No, it's really been, the support has been amazing.
Yeah, and Ms., while you're here, Bethany,
Yes.
I know that with the ICU, there's a lot of patients, or not a lot, but some that haven't made it. And I wanted to talk about, from a nurse perspective, what that's like and what what efforts have been made to help those families and help them ease their pain?
Well, I mean, as I said before, we are kind of that with the physicians, or like the lifeline. We're always talking to the families and giving them basically a play-by-play of the day and how things have gone for the patient, and being positive and trying to, keep spirits up for both patients, family members, and then each other. Because there are obviously cases where things don't go well, where the outcome isn't really what we had hoped for. And I think even more so now than any other time, we're very attached and very emotionally invested in the families and the patients and in each other and supporting each other, because it's been exhausting. It's definitely not the easiest job. I mean, we signed up for it, but it's definitely been even more emotionally challenging than it has been in the past. A lot of the patients that are on the ventilator are prone. They're very sick. They require one-to-one care, and sometimes we just have to lean on each other to try to get through every day and remain as positive as we can, despite outcomes.
How do you do that, knowing that? I mean, what goes through your mind when this patient isn't allowed any visitors and they're like on their last breath?
We, you're trying to make me cry. Yeah. We really do everything we can to virtually engage the family, whether it's with us in a room and coordinating a cell phone call to the ear of the patient, or a room phone call where we have the room phone to the patient's ear. I know of cases where people, have come in and they've been, gowned up and everything to be in the same precautions and be present in extreme cases. But, no matter what happens, we are always there. If the family is, unable to be here or be reached, that patient will not leave this world alone.
That's really, I'm sure, comforting for so many of us out there. And thank you for everything you do. I know it's emotional.
Yes, yeah, it is. But I mean, we all have things that we do to take care of ourselves outside of work. Some of us have to get a little creative now because we can't, go to the gym or go to the park and things like that. But we take care of ourselves outside of work to make sure that we can care for the patients here and remain as strong as we can.
Thank you so much for sharing with us, Bethany.
Thanks, Bethany.
Appreciate it. Okay. Well, we're going to kind of start wrapping up the tour, but I want to show one last wall that I've seen of creativity as we band together and fight this disease and pandemic.
Sure.
So everything here is covered. Was it like this before?
Yes.
It was. Okay.
Yeah, we always keep everything covered, for dust and just everything.
And what has this group been like? I mean, it's been weeks and weeks of working 24/7. How has the group fared?
I'm sorry.
How has your group fared?
Oh, the group there. This is an amazing team. You're going to make me tear up. They're strong. They're highly skilled nurses. The teamwork, like Tasha mentioned earlier, just has always been a really solid team. And I think having that foundation and then bringing on, travel nurses and the nurse extenders coming from different departments, you're just all in it together. And I think having that sense of togetherness and that we're not alone, it just has helped everybody get through every shift, every day. Yeah.
Dr. Dale and you, how has it been working under these conditions? And you've led a lot of our COVID, incident command center, a lot of work you've done on this also.
Yeah, I think it was a bit chaotic to start with. There's so much stuff. I mean, Renee, you were talking about it before, like emails overwhelming and so much planning. And but I think that people really have kind of hit their stride over the past chunk of weeks. And I mean, hats off to Renee and all the the docs and RTs and nurses and everyone, EVS crew here at Issaquah. I mean, people are getting such good care, and that's what really makes me really excited. What's this wall here? This is pretty cool.
So this is our wall of PPE preservation. One of the things that really kept me up at night truly was, how are we all going to stay safe? how am I going to keep my family safe? How am I going to keep my staff safe? How am I going to keep myself safe? I mean, I just was on my mind 24/7. Staff safety, all of us, that was probably the heaviest thing on the heart, especially when we would reach those we're at critical low for PPE. And how can we do this and make sure that we have something when we come back if we do get this huge influx? We've been very fortunate. We have never been without PPE, but one of the things that we implemented right away was saving your mask. So we have a great reuse policy. And so your mask, your N95 and face shield is what I'm referring to. And so folks use those appropriately for X amount of times. But then when they leave their shift, they always save it because we never know when you come back if there's going to be a mask available. That's kind of the sense of where we were at. And so this is our our PPE preservation. So everybody has their name and the date. And so if you're off for a few days, you come back, you're going to be safe because you have your N95 and you have your face shield.
Yeah, no, and that's only if needed, right? Extra.
Yes. Yeah, and then the next day you come in, you get your new gear, and then at the end of your shift, you save it again. And that's been...
I love the
yeah.
same, too, to everyone.
Oh,
Sacrificing so much to save so many. Thank you.
So that was one of the community support and donation. One of the meals that came was in that bag. And I got to tell you, there was a stack of cards that came from somebody else as well. And everybody took one. I have one hanging in my office. The words of encouragement, just all of that sentiment, and just we're thinking of you, and especially people saying they're staying home and staying safe so we can be here. All that has meant so much to everybody, and as you can see, I mean, they're putting their bag inside the bag.
Oh, that's great.
So,
that's
yeah.
wonderful. Well,
Yeah.
I really want to thank you for everything you've done.
Thank you.
And Dr. Dale also, and really to all the doctors and nurses and staff and respiratory therapists and everyone that it takes to make sure that we fight this battle. I mean, not just at Swedish, but at healthcare facilities all throughout the Northwest. So I think that ends our tour of the ICU, and thank you for being with us and to hear all the stories out there. We will see you next week on Facebook Live for Swedish. I'm Mona Locke. Thanks for joining us.